I've been taking care of these people for 33 years. I know them. I know if they call, they're crying. That's really unusual for that patient. And I know their history. I know, and that's a beautiful thing here. It's a beautiful gift, I think. Hi, my name is Karen Sims, and I'm a registered nurse. I've been a registered nurse for 33 years here in Calder and Burgeo. What can I tell you? I decided to become a nurse. I was a pregnant high school teenager. I didn't want to be a nurse until I went to have my baby. And when I went in to have the baby, I decided that I wanted to try it. And I did. She was 11 months old the day I started, and I haven't looked back. And today I have 2 grown daughters. Both are registered nurses, and they are awesome as well. I love emerg. I love palliative. I love the old people. I feel that they all deserve to be treated like they're your grandparents. They're not mine, but I treat them as if they were mine. And palliative has a special place in my heart. I took care of my own dad as in palliative. I took care of him at home. And I took care of my mom, who was a cardiac patient, right up until very recently. Nursing is the best thing that could have ever happened to me. And I love it. How would I like to see things change? My oldest daughter's a registered nurse. We've been insulated a little bit here because we've been blessed with very stable staff, and we always have each other's back, and we always think about, well, maybe that's our loved one there that's going to be called in, and we know that they have to go home. My daughter gets mandated regularly. She works 16 hours, and then she turns around and she goes back to work again that night for another night, and she has kids. Childcare is challenging for those things. Shift workers, I'd love to see an improvement in childcare for our younger generations. I usually go in on my weekends off, actually, because we're on opposite rotations, and I take care of my grandbabies so she can sleep. That's a big thing. I think childcare for shift workers is a major issue, and I think that it's something that really causes a lot of heartache and challenge for our new grads. And the workload is tremendous. The workload is becoming more and more challenging. The workload itself, the responsibility is more challenging. Our patients are more complex. They're no longer level 2 or level 1. Family demand in long-term care is extreme. There's not always a realistic expectation of what's expected of the staff that are there. And I don't feel, unfortunately, that the respect is there for registered nurses that it used to be. Once upon a time, if I suggested something to a patient's family, they would go right along with it. Today, I have to provide some documentation and do some surveys for probably 6 weeks on behaviors and stuff before anything can be done to change or to help us better address the care of this patient. And I don't know that that's always the best. Hi, my name is Karen Sims, and I'm a registered nurse.